The face of the pandemic, Quito, like other municipal governments, had to act quickly with an unprecedented intensity of innovative planning, collaborative networks, and logistics. Deployed at the speed of weak understanding of the food system, limited data, and undeveloped information networks. In Quito, the pandemic further confirmed the city's food insecurity. In this case, the Emergency Action Plans focuses their efforts on facilitating the distribution of food, especially for those most in need. Quito followed a five-step strategy. Map the people poverty, gender, age, disability, and immigration status. Estimate population numbers by category of vulnerability using previous projections, and calculate the economic and logistical resources that the municipality of Quito needed to mobilize in order to attend their needs. Map accessible and available food supply service, health service, and municipal service locations. Coordinate with neighborhood leaders to obtain current data in greater resolution and have a more precise idea about the conditions and location of those in greatest need. Coordinate and articulate the efforts made by the municipality with those of the private sector to provide sufficient food in the city during the health emergency. On the other hand, one of the most powerful actions to face the need for access food was the self-production. Since 2002, the municipality of the Metropolitan District of Quito has been implementing the AGRUPAR project, a participatory urban agriculture initiative. The aim is to promote agro-ecological production, social and gender justice, responsible consumption, and urban and peri-urban links with rural areas, as well as increased resilience and sustainability in Quito. During the emergency and currently during the crisis, the services of Urban Agriculture Project have had to reinvent itself to maintain the accompaniment of the farmers and attend to the requests of the citizens who want to grow their own gardens. In this way, various digital channels were activated to carry out training, technical assistance, promotion of ventures for the sale of surplus production, documentary supports to farmers for their mobilization during quarantine, and virtual tutorial videos. Social networks and testimonial videos have made Quito's farmers more visible. We can say that the production of food for self-consumption remained in good conditions of stability and diversity for families farming. On the other hand, for those gardens that generated small surpluses of production, it was an opportunity to sell diverse food to their neighbors and have an extra income. In accordance with the resilience strategy of Quito food system, the different scales of the agri-food system, neighborhood, district, municipal, or metropolitan, national, and global, each have their own dynamic, actors, relationships, problems, and solutions that must be addressed in a specific way, even though there are connections between the scales. During the sanitary emergency, the production of urban gardens has complied with the effects set out in the resilience strategy of Quito food systems, emphasizing the various ways of addressing the problem according to a scale and showing that urban agroecology is that starting point for the productive transformation of the territory. Finally, for all that I have mentioned before, we can conclude. Urban agriculture is essential within municipal planning to increase the resilience and sustainability of the cities, because it ensures availability of healthy food during crisis, reduce the mobilization and exposure needs of the person to buy food, include transformative actions of the environment to generate entrepreneurship and employment in time of crisis. The city also faces the following changes and opportunities. Finally, food will be part of municipal planning. Risk management should consider a food proposal that goes beyond the approach of delivering temporary for food rations and turns into true proposals for building food resilience. It is necessary to identify and support civil society initiatives that are permanently working and very active during the COVID-19 emergency. Citizens should be part of building urban resilience, starting in the neighborhood and with their own people. It is an opportunity to make technological and social innovations in the food system, emphasize the rescue and redistribution of food, creating a national and local regulatory framework, increase the scope of the interventions related to self-production of food at the urban and peri-urban level. Plan the development of the food hubs with emphasis on agroecology, nutrition, and health, with inclusion and equity as a strategy to improve access to food and increase the resilience of the territory. Strategic alliances between actors in the food system were strengthened during the emergency to make the response of the crisis more efficient. This is what I can share with you from the experience of the Quito, Ecuador. Thank you very much.